right, welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Oscar Sanchez from Appa Aesthetic in Miami. Oscar is known for delivering high-level smile transformations where function comes first, but aesthetics is present at every step. Today we're going to talk about what actually separates elite cosmetic dentistry from just veneers and how the best work disappears in the face. So let's get into it. Thanks for coming on, Oscar.
No problem. Thank you so much for having me. It's a pleasure.
Yeah, I'm excited. So I'm curious, like before we get into APA, because I can't wait to talk about that. Like, what's the wildest misconception in cosmetic dentistry that you've heard from a patient coming in where you're like, wow, that's just not right?
I mean, we hear a lot of stories, but the main thing is that people are scared that when they go through this procedure, they're going to end up losing all their teeth, or you have to shave them down to little pegs. And sadly, that's kind of what popular belief is based on what we've seen on the internet. And usually, what people actually get to see are the bad work. It's not really, you never see the good one. So people make a lot of decisions based on this, which in essence, it's good for them to see this bad work, so they kind of avoid these things because your teeth, you only get one set in your life, and the whole goal of doing anything is it should be long lasting. It shouldn't never lose a tooth because of you did cosmetic dentistry. It should be something that helps you improve your quality of life rather than
Well, so let's talk about that. I mean, veneers, for example, it's not just pretty teeth. Like, what's really happening underneath the hood to make them long lasting?
So the whole thing is functionality. Very few percent of patients, I would say, are purely cosmetic. Most patients over the age of 25 have a lot of wear on their teeth. Not a lot, but they have a significant amount, some more than others. You might be surprised how I've seen amounts of young patients that are very damaged. But for the most part, we do have some sort of wear, discoloration, a lot of restorations in the mouth. And cosmetic dentistry should be used to improve this. It's not just for the pretty teeth. So most people at some point in their life, they're going to need some sort of restoration. It's just that nowadays, veneers are seen as like, oh, you're doing this because you want to be vain or whatever. And it's not about that. A lot of the cases started because there is a lot of destruction and wear and misalignment and lack of proper function, which in essence affects your daily life. If you're not able to eat correctly, chew your food correctly, smile with confidence, that affects you personally. So it's not just for aesthetics. 90% of it is to fix the signs of wear and aging and to restore your mouth to how it used to be at some point when function was present.
Right. Absolutely. Well, that's a good synopsis. And I'm curious for anyone meeting you for the first time, what do you do at APA and what makes your approach different?
So our approach is very, it's bespoke. So from the initial consultation, I'm listening to the patient. I'm trying to figure out why they are here and what are they trying to accomplish. Because a lot of people say, they think that, oh, you got a treatment plan, just the teeth that you see in the mouth. That's what most cosmetic dentists do. It's like, smile, 10 teeth, okay, you need 10 veneers, 20, you need 20. And in reality, it's not a cookbook. It's not so simple. So I'm trying to listen to what they want, and then I'm trying to look in their mouth. So I take, we do the first appointment that we do is just to gather as much information as possible. We take full set of records of photos. We do x-rays to see what's going on underneath the bones and what's going on with the teeth themselves to see how healthy they are. We also take some intraoral scans so we can see their bite outside the mouth, also to see the functionality of things. And then I'm just trying to listen to them and see what their goals are. And then I'm trying to make a treatment plan because obviously the patient wants to look great, but I want to make sure that everything functions correctly so that their smile can last. So it's just figure it out and just coming to a happy medium of how I can treat this case, make the patient feel happy about themselves, yet how can I fix their mouth so they don't have these issues moving forward. Sadly, dentistry has become a reactive type of medical procedure where you have pain on a tooth, you come in, you get a filling done, or the tooth is cracked, you get an extraction or a crown or an implant, but you're just treating the problem. So tooth broke, how do I fix the tooth? But very few of us are actually thinking outside the box, meaning, why is this breaking?
Yeah.
Think about it. Teeth are stronger than bone. So if you're breaking your teeth, if you're damaging all your teeth, there is something wrong with the system.
Yeah.
So unless you figured out the system and what's breaking, what's causing this destruction, all you're doing is putting little patchwork everywhere. And that's how general public it's being treated. It's a crown here, failing there, it's something over here, and something over here, something over here, and then you start again on the top whenever they're finished. So they're in this endless loop of just fixing one thing and then something else breaking, and back and forth and back and forth. While the way that I like to treat my patient is, come in, let me look at your whole system, let me figure out what's going on. And let me give you a result that not only is going to be functional, but it's also going to be aesthetic, so that for the next 10 to 15 years, all I want you to do is come in for your cleanings every 3 to 4 months. Let me take x-rays every 6 months. Let me check your bite throughout the process. Let me make sure everything is going correct. Let me make sure that you're aging properly, you're not damaging your teeth. So let me take care of you from this point forward. I always tell patients, this is a marriage. I asked you to invest in me, but I am as equally going to invest my energy in you. So it's creating that relationship that, it's long lasting, because in 10, 15 years, guess what? I'm changing those teeth. I'm creating something new. So, and then my goal is to see that patient for 2, 3, 4 generations, take care of their teeth, their families, take care of them in general.
So how much of this, you graduated in the last 10 years, like how much of this did you learn in school? And then how much of kind of the bespoke aspects of this you learned from Dr. Appa? Zero. Yeah, go on. What was
0% in school. So school teaches you the basics. School is going to teach you how to drill in a tooth, how to make a hole in a tooth, and how to repair it. They're going to teach you the basics of everything, but they're not teaching you how to look at cases comprehensively, how to trim and plan a whole mouth comprehensively. For example, since I was in dental school, I knew who Dr. Appa was. I would have never thought that I would have been here today. Like, that was not even an idea. I was just like, wow, this guy is such an incredible dentist. And it wasn't about the pretty teeth. It was, for me, what got me was more like the energy and the passion for the industry and the passion for dentistry that he had. This is someone that I admire because of how hardworking this person was. And coming from a background that I come from, nothing was free or given. I had to work hard for everything that I have accomplished in life. That spoke to me, and I was like, damn, I wish I could ever meet this person. So graduating dental school, part of me was, I wanted to be better. I wanted to do what made most people uncomfortable. So I always said, you know what, like, I'm going to school, I'm taking all these loans, I'm living with almost nothing, like no money. I don't even know what money is. So I was like, once I graduate, yeah, I'm going to make money, but I'm going to keep the same standard of living because I don't know anything different. Yeah. So the first 3 to 4 years, so 3 years or so of my career, it was money in, money out. Every time I would make a paycheck, I was registering for a course. And I used to spend about $50,000 to $60,000 a year in continued.
wow.
It was just going back to, I would work and then weekends go to this course and then spend, take all the courses I can to, and I had some guidance into what to take. You can't just randomly take courses. I kind of created myself a path. I was like, I want to understand dentistry. So at first I was very broad into surgery, implants, occlusion, which is like how teeth function and bite. So I was kind of going broad so that I can know each field of dentistry the best I can. Because now even though I just do mainly the cosmetic portion and the veneer portion of the work, when I send a patient out to get a specific surgery or a root canal, it's no longer me sending them to the doctor and saying like, okay, let him evaluate you, see what they think so they can come back. I'm already sending them with, this is what I need you to do. Like, I am the one that's guiding the orchestra. The patient came to me, they trust me. They have to know that I have the skills and the knowledge to be able to guide them correctly. So I use specialists to make my life easier since I can't do it all. It's too much work. And each person is good at what they do. And I'm a firm believer that once you go down a single lane, you become the best at it. Once you're too broad, you're never going to be great at it. You're going to be good, but not great. And here, there's no room to be good. You have to be excellent.
Yeah.
So fast forward a little bit, I was just making myself in a way attractive to Abba, like as a dentist. I wanted him I wanted to get to his rate in his radar.
Yeah.
And soon enough, I was taking these courses in New York, and the director of the course calls me one day, and he's like, he was in New York, I was in Miami. He was like, I got to talk to you. I got something that's going to change your life. And I was like, wow. He's like, but I got to talk to you in person. I was like, you can't do it. He's like, I'll be in Miami in a couple of months. I was like, nah. I was like, what are you doing this weekend? He's like,
Yeah.
I'm having my Christmas party. And I was like, oh, nice, where? And he told me the restaurant, and I just booked a flight and showed up to his Christmas. And he's like, what are you doing here? He said you were going to change my life. You can't leave me
Yeah.
knowing. Like, I got to know what it is. So he told me that Dr. Apple was opening an office in Miami. Since I was, being of the Hispanic community and being local, I would have been a perfect fit for the office. So he was the one that made the introduction. Story short, we met. Dr. Appa called me one day. We spoke. He went to New York, interviewed me. I was in a loop for like 7 months that I didn't know what was happening until he gave me a call one day, and I was like, "What's going on?" And he's like, "You're one of the boys now." And they hired. It was incredible. It was an incredible experience. Honestly, I feel very blessed. I've learned so much under him. Not just it's just that I always tell people the most important thing that you need to learn as a dentist is to train your eye. Your hands, your clinical skills, they develop as time passes. When you do the same thing over and over again, you're going to perfect it. But what you need to learn how to do is learn how to see things. And that's the main skill that I would say Dr. Appa has over many, many dentists is the fact that he can see that final vision of how that patient should look and function before they can even realize it. So creating that skill of training your eye to look at someone and seeing how things will look, like having that, when I look at someone now, I already have the final vision in my mind. I look at them and I'm like, damn, you look so great. Like I see it. So it's that type of sharpening of your skills to become that excellent do, and then just being obsessive.
Was there any like specific continuing education course or mentorship that really helped you training the eye?
I will say mentorship is key. Continuing education courses, the correct ones, are going to make you clinically better. They're going to elevate your knowledge, and you're going to be able to understand the dentistry. Once you understand it, your hands kind of follow in the sense that you're going to learn how to make the preparations, you're going to learn how to do certain things, and then the dentistry becomes the easy part. And then it's seeing that vision of where you're going, especially in cosmetic. You have to see the end result. You have to look at someone and see what will fit in, what type of tooth will look better on that patient. Whether you want to bring things in, out, you gotta have that vision, and that comes with practice and repetition. It's repetition. When I have young doctors or students call me and ask me, what's the fastest, best way? I'm like, it's not a fast track. It is a repetitive track. I told them you're not going to feel comfortable doing a veneer case until you've done 50 to 100. That's when you're going to be comfortable. Yeah. So at first, I'm like, take your time. I remember when my first veneer case, my whole day was just that one patient for 10 teeth. It's all I wanted to do. Yeah. It was office is closed. I'm just concentrating on this one person. I would write down step by step everything that I was going to do. I had it written next to me. I would go over with my assistants. We're going to do this step, that step, because you're trying to create that second nature aspect. Everything needs to come second nature. Now I automatically do the same thing. It's like showering. You shower the same way. If you think about it, you grab the soap with one hand, you wash that one arm, or whatever you do. It's always the same pattern. Try to switch it, you're gonna feel uncomfortable. So it's the same thing when it comes to dentistry. It should just be so repetitive that it's always that way. You eliminate room for mistake, because I honestly don't have room for mistake, especially at this level. There's absolutely zero room for mistake here. So when I tackle on a case, you got to give you 100%. Your mind needs to be there. You got to start slow, and then the speed and everything just comes naturally. I used to take a full day to do 10 veneers. Now I do it. So it just comes with time. It comes with practice.
Yeah. So obviously it takes a lot of trust not knowing, if somebody isn't, familiar, hasn't had you as a doctor, as a new patient, takes a lot of trust coming as a patient and having you, fix their smile and knowing what's best for them. What do you think that some of these patients come in thinking they need, and what do they really need at the end of the day?
So a lot of them are scared of the bad things that they see. So the main thing that patients that scares the patient is not liking the result realistically, but it's more importantly it's having a set of teeth that don't fit in, that are unfamiliar. It's with anything that you do, even getting a haircut. You're used to the same person, and then you go to a new one. It's just hair; it's gonna grow back, but you're scared of the change, and the change should be positive and should be something that is rewarding for that patient. But sadly, there's so many bad things out there that we've gotten such a negative reputation. And that's why we have a specific system, a way that from the initial consult all the way to their finish, that every patient goes through. And it's all about creating that experience of trust. That it starts with us interviewing each other. Am I a good fit for you, or are you a good fit for me as a patient? And then it starts to, whenever you start the preparation, it's when I show them that initial set of temporaries, it's them seeing if I understood their vision correctly. And it's you showing them that, when you nail it, it's like you're telling them like, wow, I listened to you. This is exactly what you wanted. And then it's lowering their guard, being like, wow, like this person can actually do it. So it's the main thing is creating that trust from the doctor, from the patient, and most importantly, it's trusting the process. This is not a one-day appointment. This is not a here are your veneers, you cement them that day, and they look amazing, but you got to go through a healing phase. You got to go through your first 6 months of healing until you can see the real final result. So it's about communicating with the patient, and it's about you explaining things before they happen. When you come to that habit, if you come to me and I'm telling you like, hey, you might have some sensitivity this day, you might feel this, you might feel that. When it actually happens, you're like, oh, he told me. Yeah. Rather than you going through it and then you're in pain and you're freaking out. This is new to you. And now you're calling me, you're like, I'm in a lot of pain. And I'm just like, oh, well, it's normal. And now I'm coming up with excuses. Yeah. So the minute that you kind of just lay everything together from day one, something that our patients here get is from the moment that they make an initial phone call to the minute that they leave, they know exactly what's going to happen at every step of the way. They call the office, we send them an email with specific instructions how to get to the office, photos, map, pointing arrows, just telling you exactly how to get here, the entrance, what it's going to look like. More or less, they know, they're familiar with the person that they're seeing. So it's taking the level of anxiety and bringing it down, because now you're going into a place where you know what's going to happen there. So once you have that security and that awareness as a patient, you feel more relaxed. We understand that this is something that it's a big decision. It's a big decision for the patient, and then it's something that they need to feel comfortable. And I know how, we know how scared people are of dentists. So we're working against that. We're trying to just bring all that anxiety down so the patient can have a great experience. And that is truly why we have grown so to the level that we are right now, is because we're not just making pretty teeth and sending them out there. We're creating an excellent experience so that these patients feel that we truly care for them, and it's something so different that they don't want to go anywhere else after being here with us.
Well, and how often do you deal with patients that say, hey, aesthetics is most important to me, without or maybe neglecting like airways, or hey, this tooth keeps chipping, and actually kind of the functionality and occlusion and some of the other clinical aspects of how the mouth is actually supposed to function?
So with that being said, look, whenever you get a new patient, and it's what I was kind of talking about it sooner, it's an interview. Yeah. It's them interviewing me to see if I'm going to be the right fit for them. And it's me also interviewing them to see if I want to treat them. So we all have patients that come in and they're like, I want you to do this 60 because I want them to be prettier. But then the bite is just destroyed. Their teeth are all small and worn off. Right. They want to have nice, beautiful teeth. But the environment, the system, it's not going to allow it. because it's going to break everything.
Yep.
So it's you learning, you maturing enough as a dentist and understanding enough of dentistry that you know that's going to fail. So whenever you get a case like that, we're like, look, I don't care. I just want the six to be pretty.
Yeah.
It's not a good fit because,
Right.
you know, look, I'm not going to be the one to do that to you.
Yeah. Yeah.
You're going to be happy day one. It's going to last you a month or two, and then they're going to break it. And then I'm the bad guy.
Right.
And I sleep well at night. I like to go home with my wife, with my baby, go to sleep, disconnect. I don't like having stresses. So I only do cases. There are cases that I tell patients, look, this is an all or none. This is a case that you have to treat your whole mouth, or you don't do anything at all, and you wear a night guard and you protect them and you make them last as long as they can. There are cases where you can start with the top and you tell the patients, look, I'm going to start with the top, but you are a medium to high risk of breaking things. So if you do not wear this night guard until we do your lower teeth to fix the functionality, you're going to break something. They have to understand that. So these patients, we ask for, we're going to help you to kind of bend a little bit, but you also need to know that if you don't wear this night guard, you're going to break things, and it's not going to be our fault. It's going to be your fault. They have to understand that. So it's about informing the patient, educating them into why they need a certain treatment plan. We don't treatment plan just to add teeth to the treatment plan. I want to do what's right for that patient. What do they need to have a good bite that's going to be long lasting? And what do they also need to have a great smile that from all angles, not just in a static photo, they're going to enjoy it, and that's the most important thing.
Well, and you're talking about being able to see. I want to circle back to that real quick because there's obviously no like cookie cutter smile for you. I mean, it seems like you're really looking for each individual case. Are you looking at like face shape or personality, age, lifestyle? Like what plays a big role in what you see?
All of the above.
Yeah.
Everything is, teeth are so impactful in how you perceive other people. If you meet somebody and they're missing a bunch of teeth and have black teeth everywhere and caries, I mean, sadly, you're going to have an opinion of that person, and it's going to be negative. You're going to assume that person doesn't take care of themselves. When you're talking to someone, I always tell people, and I point it right away, when you're talking to me, you're looking at my mouth more than you are at my eyes. You're going back and forth. So it's a presentation card. The way that I shape your teeth can make you look more aggressive versus looking a little bit more delicate in some cases. So the teeth themselves have personality. Wow. What I like to do is look at what the patient is coming in with. Look at their actual teeth in their mouth. Sometimes the damage is not so bad to where you can tell. Sometimes they're very worn off and can't really tell. That's why you will ask for older photos if they have them. But it's a matter of creating what they should have, what nature gave them. That's how I see it. I like to pick clues from their teeth, line angles, round, square, all those things. I like to look at them because I like to recreate that. A perfect cosmetic dentistry case, dental case, is one that if you could have a magic wand, you would wave it one time and all the edges that have been worn off are back. Wave it a second time, they're perfectly aligned in the correct position, and wave it a third time, and they're the correct color for that patient. That is perfect dentistry. So how do I bring back what God gave you? How do I recreate that, align in the correct way, and just make it blend and disappear? You don't want to attract attention. That's the most important thing. When teeth are crooked, it catches your eye. When something is dark, it catches your eye. So you want to have just this smile that I tell patients, they should just disappear. People should look at you. Hey, it was funny because I'm going to tell you this. And today I had a patient that actually messaged me this because she posted a photo. I was like, great smile. And then she sent a screenshot of her friend, and her friend was like, look, I got to ask you, you look amazing. I can't tell what it is, but you just look different, and I cannot put my finger on it. And she was just so happy. That friend said that. And she told her, I was like, I got my teeth done. And that's what I told her. I told her the same story. I was like, my goal is for you to receive that text, for you to have that friend that tells you, you look amazing, and I don't know what it is. You do Botox, you shower, I don't even know, you know what I mean? Like, you look great, and you can't put your finger on it. And that's the best compliment that you have. If somebody points at you and they tell you where you get your veneers done, you can tell. You can tell already. You're
even though they're
100%.
supposed to blend in, right? Well, I'm curious with that patient that you're really proud of the treatment, like what was wrong before? Like what or not what was wrong, but like what was standing out that wasn't blending in before that you said, "Hey, we need to fix this."
So she came in already wanting to get her smile done. Her bite was a little bit collapsed. She's a very beautiful lady. Bite was collapsed, teeth were two in. When she smiled, the attention was to the front 4 to 6 teeth, and everything in the back was kind of hiding away, which is most people. A lot of people, when you go canine back, the teeth are caved in and you don't really get to see a fuller smile. So it was about creating that fullness of the smile, and you gotta just get it right because you can make somebody look thick, heavier or thinner, depending on how you expand that arch. And then by opening the bite, I'm able to recreate the lower third of the face, so making you look, give you that nice shape rather than being all collapsed. So it's you just gotta like play with the different tools that we have to be able to create that right profile for that patient and do it in a manner that looks natural. Picking a color that it's everybody wants to have white teeth. Nobody has to have one yellow teeth. I understand it, but what is the perfect white? Like, what is the white that you're gonna pick? Because if you go, you want to walk into a room at the same time that your teeth walk in. You don't want your teeth to walk in before you. You gotta pick that color that is. But some people don't care. If they want super white, then super white it is. At least I'm gonna make it look natural. you know.
Yeah.
So, yeah,
Well,
it's not about the main thing as a dentist. You just want to say this: when you mature as a dentist, you stop doing the dentistry for you and you do it for your patients. That's the key. It's about them and it's about you using your skill and your knowledge to make it the best it can be with their vision being the priority.
yeah. And what does it take to do patient first dentistry? How much of it is it digital and how much is done by hand? What does it take?
So digital dentistry versus analog dentistry. What's better? It depends on case by case. What works in your office. I am a firm believer that there's nothing like something that is custom made and that has a human touch to it. Why? Because it's not going to be 100% perfect. When you create perfection here, all the teeth is, Sanchez the same side, the laterals the same. When you create that perfection in an imperfect face, because no one's face is perfectly symmetrical, one eye is higher than the other, one side is stronger than the other. So when you create perfection in something that is not perfect, once again, a lot of attention drives to this area. When you create something natural that flows, it's all about creating that harmony within the smile where teeth look straight and beautiful, but there's little nonsense and little imperfections here and there that are not made because we made a mistake. We actually made them with intention to create it like that. So when we do those things, the smile tends to look more natural. Digital dentistry is great, and it's being pushed into everyone, and it's making life easier. But it's also cutting down on creativity because now you're not as creative. Why spend the extra time? I can just copy and paste it, put it in this computer, have somebody So it takes the art away from it, and we like that. Like whenever you're really into this, like myself, I like to sit there. I like to have the chance to create something. I like the challenge of creating something beautiful and trying to understand what the patient wants and have that human touch to it. Like I'm passionate about what I do. So like, why cut that off my schedule so that I can just be faster and produce more? I don't care about that. Right. Digital dentistry has its place. It helps a lot of dentists because now they don't, you don't need to have a certain skill level because honestly, not everybody's going to have the same skill level. Some people are not, but they're going to use different tools to get to the same place. So it has its place. I will say it will never replace real bespoke dentistry. Digital dentistry will never replace it, but it will give you a good result generally. So it's going to help dentistry as a whole because as a whole, it will elevate the level that we're practicing. So there's not a big difference between some dentists and others. So it's going to elevate dentistry as a whole, but everybody at the top is always going to be because of their hand skill and their artistic level.
Yeah. Well, I can tell you've got a deep obsession for this. I'm curious just to wrap it up. Like, if you were talking to another, dentist in the field, what would you say? I mean, obviously, there's no lack of vision. You knew what you wanted. You got it. You're working at your dream practice and on a path. You're feeling successful. So, what would you say? How do you get that vision? Like, what steps would you recommend taking?
It's look, never give up. Reach and model those that you admire. So have your goal, have your Dr. Appa, and say, I want to be like that person, see their habits or everything. Try to emulate them. Try to reach out. Try to ask for advice. And then do what makes most uncomfortable. You know how many messages I get, long messages, I really want to be like you, admire me. What courses can I take? And then I give them a small list of courses and they're like, oh, but it's too expensive. I have to travel. So do what make others uncomfortable. Out of my class, I don't think there's been another dentist in my class that has taken not even a fraction of the courses that I've taken. And that's out of 100 people. So imagine, not everybody has that drive. So you gotta have drive first. Mentorship is amazing. And then try to, get yourself exposed to this type of cases, to this type of environment. Try to just absorb as much as you can. Whenever you're shadowing somebody that you admire, try to take notes. Try to really absorb what's happening. When I watch Dr. Appa sit down and work on a patient, I'm not looking at how he's prepping teeth. I'm honestly looking at how, at first I would sit down and just watch him, like, why is he moving his head this way? Why is he breathing a certain way? I don't know. I want to understand why was he doing certain things. Not really why was he prepping. Like, I know how to prep a tooth, but I want to see what he was seeing. That's the most important. Like, how can you get in their brain and see how their brain kind of functions and how they see things? So just don't give up and just know that this is going to be a career for life. So it's normal for you to have a period of just grinding and just concentrated on one thing so that you can reap the benefits that this career has for you in the future.
Well, and what resources would you recommend for finding courses for continuing education or mentorship?
I always recommend, well, we are doing courses now, okay? So every year we have a symposium. We have one in 2 months in March in Miami. And in this symposium, we're going to break down everything that we do from the minute that we pick up the phone to the preps to every single step of the way. I think the course is almost sold out. I think it's sold out, but just reach out and see if somehow you can get in, okay? Then we're going to be opening multiple courses moving forward where dentists will be able to sign up with us and have more like a one-on-one experience, and future courses where we're going to be really hands-on for them. I also always recommend the Koi Center in Seattle. For me, that was one of the biggest additions to my career. I think it made me the dentist that I am today, and I started early on. And you're going to learn everything there, from implants to occlusion to endodont. You're going to learn everything. So just going to be as a whole, you're going to be a better dentist. And just try to see who you admire and what they're doing, and ask for help. Literally, ask for help. We will help you.
Well, Oscar, how do people find you afterwards that I can include in the show notes?
So you can follow my IG is Dentistry by Oscar. And in there, I post all my cases. I have all the links to our office page in case you want to do a consultation. You can also DM me. I'm pretty quick at answering everybody, or just call the office and ask to have an.
Thanks, Oscar. This has been so great. Thanks for sharing your obsession, and I know there's a lot of tidbits that people are going to love to hear in this. So I really appreciate having you on, and we'll see you next time.
Thank you so much, brother. It was a pleasure. I really enjoyed this, and I hope it was helpful for your listeners and my listeners. If you guys ever have any questions, like I said, just feel free to reach out. And thank you for what you're doing, because you're really helping out the community, and that's what it's all about. Like, let them know that there's something better out there, something great out there, and that they can always have that second hand looking at them, second set of eyes, and there's always help for everybody. So appreciate it.
Thanks, Oscar. So inspirational. I love it. Until next time.
Thank you, brother.